As you know, child health is an indication of how well we are doing in the community or how badly we're doing. As Nelson Mandela said that, to know the development of a nation, you have to look at the children.
The code process is an important part of the study, so because we have lots of information coming from different sources, from the verbal autopsy, from the clinical data, from the microbiology and from the pathology, and then all this data are pulled together and we take the decision, the final decision based on all this information.
That information is shared and that can influence policies, programs and decision making both nationally, locally and internationally that can ultimately help promote child health and decrease the high mortality that's currently affecting Sierra Leone as a whole and particularly our CHAMPS catchment area.
Most of the time we rely on clinical information, on history, or verbal autopsy. Some of that information is not complete because verbal autopsy depends on what the mother remembers. Clinical presentation depends on what the clinicians have found. But many times some of the information is looking close in the tissue, looking close in the blood specimen, more at a cellular level.
So what the decode process brings to our site is that it enables the site as well as the people in the facility to truly understand what the causes of death are. And most importantly, it also allows us to understand as to whether there are any factors which we might be able to redress that could have prevented those deaths.
The information coming out of CHAMPS is very rich and it's giving us information that is an eye-opener and sort of directs us as to what areas we can be able to focus on in health so that we can be able to have maximal impact on reducing child mortality.
Our ultimate goal is to prevent the child mortality, but so now we have some level of data at our hand, but we need to identify the ways and the strategy how to communicate this data into action. Translate this data into action, and using this data, how we can actually stay forward for our single goal, that to prevent the child mortality.
It's something one can really relate to. That is, we are very positive that it can change the way we take on public health interventions.
CHAMPS brings about a paradigm shift in terms of our understanding of the causes of childhood deaths, and the reason it does so is that we can now drill down to the detail as to the exact reason why a child died.
We need to start paying attention to the other things that force children to fall sick or to die, or mothers not to even have a baby to hold. And those are things that we could do something about, and they are right there in the communities.
One of the motto of CHAMPS is data for action. If the ultimate goal is only to generate data, it is meaningless. It should be translated into action. So that action should be done by health executive bodies, the various health authorities in different countries. So I say use the data CHAMPS is generating.